Hey, and welcome to the video all about 5 powerful tips to help you prevent some hip surgery or hip replacement or any kind of surgery that's going to potentially put you in a poor position later on in life. Now, make sure you stick around for tip number 4 because it's quite unusual and a bit of a funny one. But what we want to do with these tips is basically try and delay as much surgery as we can, or even not needed at all. I mean, there's plenty of stuff we can do just to use your body the way it was designed, to make sure that you are using it to the best of your ability. Now, my name's Mick, I'm from Melbourne Soft Tissue Therapy, and I'm all about trying to unleash the body's potential with the body you are given. Like, unfortunately, in today's society, we have a very poor sedentary lifestyle, too much sitting down, lack of movement, immobile, stiff joints, wearing all the wrong shoes, and all of that is just a recipe for disaster to eventually go down the road of having unnecessary surgeries. Now, you look at the stats around surgeries at the moment. In the USA alone last year, there was 450,000 surgeries, and that's just way too high. Like, surgeons are just loving being able to slice and dice through these hips and think that's the quickest fix. Now, surgery, yes, it can be an option, but it is very much the last possible option. Once you've exhausted all the natural remedies, natural movement, natural everything that we can do with our body before we go down the line of hip surgery. So, powerful tip number 1 is basically movement. Now, movement is the best form of medicine for your body. Unfortunately, most of us today just don't use enough movement in our everyday lives. Yes, we go to the gym, yes, we walk the dog, we play with the kids, but it's not enough to do what a body was designed to do. Unfortunately, if we go look at our occupation, our jobs throughout the day, that is what we most commonly do, and that's what our body adapts to. And unfortunately, for the majority of humans, that is spent at a desk, in a car, looking down at the computer, or just immobile in some way. Yes, you may go to the gym, which does help, but 1 hour at the gym compared to 6, 7, 8, even 10 plus hours of the day sat down on your butt, it's just a very minimal amount of activity and movement needed to help keep our joints nice and strong and mobile. Now, our joints are actually designed to last a good 100 plus years. And unfortunately, as we grow older, we get a lot of arthritis. Wear and tear of the joints is what people tend to talk about. And it's actually the complete opposite. The reason why we kind of develop this arthritis and they kind of get this wear and tear is through the lack of movement. It's not wear and tear from using them too much. It's actually from using them not enough. Because basically, as you are inactive throughout the day, immobile, not being movement friendly, active throughout your day, the brain starts going, okay, if you don't want to use your hip, if you don't want to use your knee, why am I bothering spending all this energy by sending all the blood flow to it? So it just stops doing it. And basically that joint, especially around the big joints, the knees and the hips, they just start to degenerate, and that's where you start to get the arthritis, a lot of pain, and that leads you down that road of potential surgery. So the number one best thing to start doing is just simply moving. Use your body the way it was designed and find these new range of motions that you've not used in forever. Like, get down on the floor, start exploring the floor more instead of on the sofa. Get out your chair a little bit more, because basically that chair is your kind of brace for the world. And when you are sitting down, which we're designed to do, but not for extended periods of time, so we need to get out of our chairs, get out of our sofas, and get on the floor, explore the floor more, because yes, it's not as comfortable, but because it's not as comfortable, it's going to get you moving a little bit more and changing positions. When you kind of get stuck in a comfortable chair, stuck in a comfortable sofa, you can stay there for hours on end. And then you finally move after those couple of hours, and that's where the pain comes on. And basically, pain comes in to the body as it's a request of the brain to want you to change. It's a request for change. So that's why the beauty of being on the floor is that you can't get in a comfortable position for too long, which makes you move. So again, the more movement you get, more blood flow, more muscle activation, more nerve supply, all that just comes together to create a really good recipe of a good movement-rich day. So number 1 tip is just to move more. Now, it doesn't mean you have to go to the gym all the time or go for runs or anything like that. It's just moving a little bit more than what you're currently doing. Simply going for a walk, getting out of your desk, getting out of your chair, getting out of the car a bit more. Just adding these on a little bit more bite-sized chunks so you don't overdo it and exhaust the body. and just try and add in as much movement for your day as possible. Powerful tip number 2. Now, the best thing you can do is assess your bed and your mattress. There's a reason why we spend a third of our lifetime in bed. Sleep is, very, very important for everything we do. But if you don't have the right setup with your mattress and your pillow, it can really cause a lot of dramas in the back, in the hips, in the knees. So my recommendation is try and actually go a little bit more on the firmer side of your mattress. Won't be as comfortable to start off with, but your body will easily adapt. It may take a couple of days just to get used to this new mattress, but if your mattress is too soft, your body's going to, again, just like a sofa and a chair, sink into that kind of comfortable position. And that mattress is basically your external support. All the muscles we need to support your posture and stability and all that don't need to be used throughout the night. So then the mattress is doing it for you. So as soon as you start to get up in the morning, there's that stiff back, there's that stiff knee, there's that stiff hip. But if you have kind of a more of a firmer mattress, again, your body's going to just want to move that a little bit more and actually use your body's muscles and joints to actively move, use that blood flow, use that activation, and keep your body working even though you're asleep. So it's a big difference throughout the night, because if you think about it, again, it's a third of your lifetime. So investing in a really good mattress, like on the firmer side of things, is so beneficial to your health and well-being, your movement, your pain, your joints, and just your future of being hopefully pain-free. And quickly add that into the pillow as well. You don't want just this soft pillow that's just gonna keep you comfortable, but again, we want to make sure that head and neck is nice and supported. Not too supported, but just enough for you to be working the neck and not wake up with a crick in the neck, which is very common these days. So yeah, get yourself a firmer mattress. Powerful tip number 3 is basically nutrition. Nutrition, with everything just like sleep, in tip number 2, is so important to our everyday health and well-being, and making sure you're eating enough of the right foods to keep inflammation down, get rid of some of all that inflammation that comes from highly flammable foods. Get yourself a nutritionist, get yourself some kind of dietitian to give you help with that, because it's not as easy as it sounds. There are so many things out there on the internet to Google, like, what should I eat? Who are you going to believe? The best thing to do is whole foods, nice and fresh, fruit and veg, meat, that's you. Or if you're veggie, go for that too. But just trying to stay away from the common things, a lot of sugar, fast food and all that. And basically with the joints, if you're eating a lot of foods with big inflammation, a lot of sugar, a lot of refined carbs and all that, just man-made crap, that's really going to put a lot of inflammation on the joint and keep that pain around for a lot longer than you want. So really hone in on your nutrition, and that's going to help get rid of some of that pain and allow your joints to work healthy, nice and mobile, all that fluidity through the movements, and move the way it was designed. Powerful tip number 4, now the unusual one we were talking about at the start, is basically just trying to squeeze your butt as much as you can while sat down, while stood up, whilst you're walking, running, just standing there. We have big, powerful butts for a reason. Everybody does. There's a reason why we are the only ones who really stand up on 2 feet of all the animals, and it separates us from the rest of wildlife. So the glutes, the big butt, that's what gets us going. If our glutes are not working the way they're designed, something else has to compensate for that. And normally comes from the lower back and all the other joints around. So if you don't have a good, strong glute complex, that hip joint, big ball of the femur coming into the acetabulum of the hip, it's not going to be supported well. And that's where arthritis can come along, that wear and tear, because this is not a healthy joint. When you have healthy, strong, activated glutes, they will take away a lot of pain. A lot of lower back pain gone, a lot of hip pain, a lot of knee pain. If in doubt, make the glutes stronger. So by simply creating awareness to start off with, just start squeezing the glutes. Because unfortunately, like we said earlier, if we spend a lot of our days sat on our butt, we kind of get glute amnesia between the brain and the glutes because they're sat on all day. And a good little trick to do is like try and squeeze your butt when you when you sat down compared to stood up, and you'll see the difference of activation you'll get from just those 2 different movements. So trying to get a stronger, more active glute while sat down will help you a lot more if you do have a sedentary job. So every time you sit down, squeeze your butt as hard as you can, try and get one butt going at the other, try and make them dance back and forth, make a bit of game out of it, and just create that awareness of how to use your glutes, and you will see the difference in your overall posture, your walking gait, your running gait, all your movements, especially in the gym as well, just by getting those glutes more aware and stronger. Powerful tip number 5 is creating yourself a nice mobility routine, ideally at a night time before you go into bed. That's going to help down regulate the system and get you in a good state for having a good night's sleep. And a mobility routine at night could be anywhere from yoga, just simple stretching, just being on the floor, just stretching out some tight muscles, and especially in and around those hips, knees, lower back. Relaxing yourself from the day that you've potentially had at the desk a bit too long, driving around, just open up those joints, getting the blood flowing, and like I say, it will help just open up the parasympathetic nervous system, which will just pull you down into a nice relaxed state and help give you a much deeper, nicer sleep. So it only needs to be 5-10 minutes, whether that's just getting onto the foam roller, getting the ball into tight muscles or anything, or like I said before, just simple yoga stretches, a bit of just static stretching, a little bit dynamic, just down regulating the body before you go away for slumber, and just give those joints a nice little relaxation at the end of the night. So there you go, there's 5 powerful tips to help avoid any kind of hip surgery. Try and follow them as much as you can, add them into your everyday routine. Any questions, drop them below, and as always, please like the video and subscribe and share as much as possible. Have a great day.